Okay, Elisa, I think you can get started.
I want to welcome everybody to our May 17th Gerontological Society of America Oral Health Interest Group meeting. We do these virtually a couple of times a year, so it's great to see so many faces out there. A couple of housekeeping. If all of you out there who are meeting participant can actually put your name in the participant section, that would be awesome, so that we can actually know who you are. We also ask that all of you mute yourselves. Looks like most of you have. That's awesome. But if any of you haven't, please do put yourself on mute. We're going to be using the chat for questions, so please feel free to put in there any questions that you have, and we'll be monitoring that and try to get people in, their questions in, depending on where it kind of fits into our program. So we may not get to it right away, but we will be noticing your comments and wanting to let others know of it. Lastly, as you probably already saw, we are recording this, and that recording will be on Gerontological Society of America website, which is geron.org. Feel free to, we'll probably put that in the chat so that you all can just see what that is and just copy and paste it. We are doing closed captioning. That has been enabled. So if you go down to the bottom of your screen where it says show captions, you should be able to access that as well. I think that's it for our announcements. We got a couple people still out there as meeting participants. So if you're a meeting participant, please actually go and rename yourself is what you need to do. If you go and see who the participants are in that section on the bottom, go to yourself and rename yourself. That would be great. Okay. So we're gonna move on. If you can advance the slide. Our agenda today, we've got a really packed meeting today. And also, I do see people are putting in the chat, kind of as people do, who you are, where you're from. Welcome, Ted. Great to see you. Stephanie, Robert, Sarah, Helen. Please continue to do that. That would be great to not only see who's out there, but where you guys are from. All right. Packed meeting. We've got Michelle starting out, going to tell us a bit about some updates on Medicare. There's actually some stuff that came out this morning, so I'm sure she's going to touch on that as well.
No, I haven't heard it. You'll have to tell me.
Well, we will update everyone on that.
Okay. Good.
Yeah, Karen is our fearless leader who from GSA who keeps us organized, and yeah, every second counts. She already sent us out some new information. That's just an active. The Medicare changes are just active out there. Okay, Sam Zwetchkenbaum is also going to give us a presentation from the Association of State and Territorial Dental Directors. They have a new toolkit out that we want everyone to be aware of and how to utilize it and access it. So he'll be doing a presentation on that. I know some of you I saw at the AADOCR meeting in Portland. We had, thankfully, due to Jane Weintraub, she coordinated the meeting with the meeting this year to be on aging and oral health. So Chris Fox is here to give us all an update on kind of what all happened, and we'll have a little discussion on that as well. Not just a meeting, but what's going on post meeting. And then as always, we'll kind of give you an update on what's going on with GSA. All right, moving us forward, I'd like to pass the baton over to our chair, Steve Shuman, to introduce us and our sponsor.
Thanks, Elisa, and welcome everyone. Great to see the attendance so far, and glad you could all take a little time to spend with us today. I'm Steve Shuman. I'm the chair of this wonderful GSA Oral Health Work Group. It's been a privilege to work with all these folks for, I guess we're going on 6-7 years now, and they are, along with myself from here in Minnesota, Susie Keeper from the University of Oklahoma Health Science Center. Susie is our magical nurse dental hygiene person who brings that perspective to our discussions. Dr. Chen now from Ohio State, recently relocated from Iowa. Michèle Saunders from down in San Antonio, one of the, I guess I'll embarrass her, I'll call her one of the grandmothers or mothers of the geriatric dentistry movement that began many years ago. Dr. Elisa Ghezzi from Michigan, who is one of our, she and Michèle and Bei Wu are also conveners of our oral health work group or interest group. So Elisa's with us and overseeing this meeting along with Michèle and Dr. Bei Wu, who is from the NYU School of Nursing and is a highly distinguished researcher there on oral health research. So again, a wonderful group of people. Much of what we're talking about and you're seeing here and we'll be reviewing today is the hard work of all of these people. Thanks, Elisa. Oh, one more comment. All of what we're doing too has been generously supported by Halion, formerly GSK Consumer Healthcare, and I believe, or I hope, we have a couple. I think Kim Adenazi is on. I just saw sign in, and perhaps Elizabeth Brewer from Halion as well. I think they'll be tuning in today, and we want to thank them for all of their generous support over the years.
Absolutely. So moving us forward, I want to introduce our first speaker. Michèle will be speaking on, giving us an update on what's going on with Medicare coverage for medically necessary oral treatment. So take it away, Michèle.
Okay, great. And thanks, Elisa. I did get the email from Karen, so at the appropriate moment, I will mention that as well. Did I take myself off mute? Yes. All right, good. Thanks. Okay, it didn't work. Next. Thank you. Okay. GSA is an active member of the Consortium for Medically Necessary Oral Health Coverage. We are guided by documented evidence that medically necessary treatment of oral microbial infections is essential to combating and preventing a wide range of chronic conditions. We undertake educational, community building, and advocacy efforts to expand access to medically necessary oral health care. We have more than 240 members. We have dental, medical, and nursing groups. We have patient and consumer advocates and care delivery providers. And the whole goal is to help CMS understand better care, lower cost. Next. All right. In the CMS physician fee schedule for 2023, there's codification for medical coverage in Medicare for organ transplant surgery, cardiac valve replacement, valvuloplasty procedures, and head and neck cancers. It established a process for expanding Medicare coverage of medically necessary oral and dental services, proposing additional clinical scenarios and clinical evidence as being inextricably linked and substantially related to the clinical success of other covered medical services. We applaud the Santa Fe Group and the Sjogren's Foundation for their leadership in crafting and submitting nominations for extended medical coverage of medically necessary oral and dental therapies in the Medicare program. The physician fee schedule does these things, and we're hoping for a positive outcome, which we'll discuss shortly. As we recognize the clinical, fiscal, and human importance of medically necessary treatment, the final rule also established a novel process for stakeholders to propose additional clinical scenarios in which dental treatment is demonstrated by clinical evidence as being inextricably linked and substantially related to the integral and clinical success of other covered medical services. And so February 10th, we submitted those expansions, and we'll get to those very shortly. Next. All right, the Santa Fe group supported that nomination for diabetes care with extensive evidence linking untreated oral infection and diabetes. Santa Fe group also worked on the blood and solid tumor cancer nomination, showing the close association between cancer treatment, and immunosuppression, as well as a heightened risk of oral health-related complications during chemo and radiation adjuvant therapies. Lastly, the Sjogren's Foundation did the work on systemic health and autoimmune disease, showing the extensive evidence that impacted persons are at much higher risk of advanced dental decay, tooth loss, and gum disease, and also that there's evidence linking periodontitis to the development of rheumatoid arthritis and other autoimmune diseases. Next. Thank you. There are 3 briefing documents for each of these 3 nominated areas, as you can see, and you will be able to download them on the consortium website, which I'll give you on the next page, for each of these recommendation briefing documents. And they're really, as you can see, not only attractive, but extremely informative. So you're free to download those. And next. And here's the consortium website, which is oralhealthconsortium.org. So you can take that down and go to it and download those 3 briefing documents for the 3 nominations. We've been fortunate to be able to get supporting congressional sign-on letter to CMS from Senator Ben Cardin from Maryland, Senator Debbie Stabenow from Michigan, and on the House side, Representative Lloyd Doggett from the 35th District in Texas, and Representative Nanette Barragan, the 45th District of California. We've also been able to get key advocacy with key agencies, and most importantly, we're collecting stories. So we have more than 115 members of the House who have already signed on to the letter, led by Representatives Doggett and Barragan, and the consortium is working to set up meetings with key agencies in the administration, including CMS, the Office of Management and Budget, the White House Domestic Policy Council, and others, and we will, of course, keep you posted on outcomes. Likewise, and importantly, we need stories from the field. We invite you to share your stories linking oral health to overall health that we can share in our advocacy efforts. Please go to our oral health interest group community on GSA Connect, where you can include those stories, and as many as you can that are actually from patients would be even better, or about patients. Next slide. CMS will issue its proposed rule in early July. Based on what is considered from our recommendations, we'll know some of our next steps, depending on how the conditions we submitted, the 3, are accepted. After the final rule in November, the clock starts again for the next round of nominations of expansion areas for February 10th of 2024. And I think before we don't go to the next slide yet, this is where I read what CMS issued this morning. CMS updated its strategic plan page to include a new cross-cutting initiative, oral health. Through this CCI, CMS will implement policy changes and consider opportunities through existing authorities to expand access to oral health coverage. CMS updated the health equity pillar fact sheet, and you can find that on the CMS website, that details key actions undertaken by CMS centers and offices to advance health equity. Finally, CMS has added a new fact sheet to the strategy page with updates to integrating the 3 M's, Medicare, Medicaid, and Marketplace. This fact sheet outlines how CMS has begun to develop approaches to provide alignment and consistency across programs, promoting seamless continuity of care, including experiences with healthcare providers and health coverage for people served by the 3 M's. And next slide. It is important for us to continue to participate in this sustained effort to advance medically necessary dental treatments under Medicare that we know are essential to our health as we age. Think about the policy implications of your work. Please continue to share your research, advocate with your elected officials. Recognize that as your professional membership organization, GSA continues to work to help translate your research into sound policy at the federal level so that we can realize our vision of meaningful lives as we and our patients, colleagues, and others age. And I think we're going to wait for questions until the discussion section. Elisa?
Great. Karen, do we want to take a moment to, if anyone does have any comments?
Yeah,
Great.
I was trying to get myself off of mute. Yeah, Michelle, why don't we have people answer questions?
Okay, that'd be great. I can't see them, so you'll have to identify them if there are any.
Currently, there aren't any in the chat, though I do want to highlight that Ted mentioned that both Senators Cardin and Stabenow are retiring this year. And well, actually, it is a question. He was questioning, are there other U.S. senators in support of the congressional sign-on letter?
Yes, but we're waiting for sign-ons now. We've had the letter circulate through the House first. That's why there are more there at this time. And we don't have a list of the Senate yet, but we will.
And so again, I think, it's important to note that, there's this whole group of organizations that are doing so much work out there. I think our biggest challenge in geriatric dentistry right now is that we don't have good mechanisms to help most of us know what's going on at the national level and kind of keep up to date on it. And again, GSA is working hard to do that. It might be best, again, GSA has methods like through their Connect program for us to be able to share some of that information. That is a member-only access point, though. So, again, it might be worth considering, being able to utilize mechanisms like that for us to be able to keep people a bit more up to date on what's going on. Because again, there was something up just this morning that's pretty significant. It's just constantly changing, things are moving. I run into people who are like, you know what, I'm really concerned about this. Where can I find information? And I don't know that there's really great touch points for that. And I think, again, that's why GSA is doing what we're doing to kind of serve in that way. What are other resources out there that other people are aware of? Or how can we be more effective to help people?
Actually, I think that that's an excellent idea. And if people actually join GSA and get access to Connect, they're going to find information about this, no matter their profession, beyond what information is provided by the local dental organizations. Yes, and Ted, we have identified other U.S. senators to help shepherd the letter through. So that's an ongoing effort.
Right. I just concerned, can both Senators Cardin and Stabenow, we appreciate their support, but they're retiring. And, we are perhaps all aware of the issues regarding Senator Feinstein,
Right. Well, Patricia D'Antonio is our individual at GSA who is working really hard in this effort. And so she will assure that the entire consortium is working to help bring on more senators. And
Great.
So I would urge each of us attending this meeting to actually contact our own senators to ask them to sign on to the letter.
Yeah, preferably someone who's not geriatric themselves.
or set to retire. I don't care.
Yeah, exactly.
Yes.
This is Karen Tracy at GSA. I'll speak with Trish D'Antonio, who unfortunately is unable to be on this call today. She has another commitment, but I'll let her know of your question and see how she might be able to respond as soon as possible as well.
Great. She can put it on GSA Connect.
And I would say, it's GSA and Trish are, for me, the place that they know the pulse of what's going on. And we really are indebted in geriatric dentistry, oral health for the aging, to have an organization like this that is so engaged, that is fighting for us. We haven't had that in past decades. And again, Trish knows more than I do. And it's almost sad, because I should know what's going on with my own field. But to more, it's to her credit that is how engaged GSA is. Trish is an excellent resource and advocate for all of us.
I'd also say that the consortium that helped put together all of these recommendations to CMS is absolutely fantastic. We're really honored to be part of it, but they are excellent at what they're doing too. Thank you, guys.
And not only is it an excellent resource for all the oral health people, but for all the rest of the professions as well. So we really are very grateful for that to GSA.
Michèle, do you want to speak to the question out there? What is organized dentistry's perspective? ADA, AGD?
Yes, I did. I'm not looking at the chat, so instead I missed it. So thank you for calling my attention to that. Well, we're hoping it's evolving. And as everyone knows, organized dentistry is a very conservative group, and they are not enthusiastic at this time. That doesn't mean that it's not growing, and it is growing. I've met a number of trustees when I've attended those ADA meetings, and other individuals who are very active on their committees, and they are very pro having this coverage, but still the leadership is not. So until everyone meets in the middle, it's a little bit of an uphill climb, but I'm certainly not giving up hope. And we have maintained open contact with them, and Steve may have something to add to that.
I would just add that I believe there are people in the ADA now who understand the issues. Marko Vucevic was at an MDA, Minnesota Dental Association meeting here a few months back, and I think put it to the audience and to the Minnesota Dental Association members quite clearly that the ADA has to sort of make a decision about what they want to advocate for. If they really want to advocate for oral health for all and want to claim that it's important to everybody's health, then they're going to have to recognize the need to expand coverage. On the other hand, he pointed out that if the ADA wants to continue on the way they have and be a profession that serves fewer people, including many who don't have access, or who don't, leaving out people who don't have access, then I think they're going to have to make that decision too. And he was, I think, very clear, and he said very openly, this is what the data and the numbers are telling us. And we know that financial barriers are probably are the biggest obstacle for people getting access to care. And
right.
So if the ADA wants to address that, they're going to have to make some decisions.
Yes, and to mention this to, is it Heather Simmons? The note flashed up quickly when you asked, isn't it a service to dentists to actually be involved with this? And I would draw your attention to probably, and Steve may add to this too, what has been their greatest, the ADA's, organized dentistry, greatest opposition. And that's their fear of their loss of autonomy I
Right.
mean, the reason the American Dental Association did not join medicine when Lyndon Johnson established Medicare and Medicaid back in the 60s was for that reason. They did not want a third party telling them what they can and cannot do with their patients. That was their primary reason then. Now, it is not only that, it's also they fear they will not be remunerated adequately.
Mhm.
And that's a real issue, because we've all watched medicine get fewer and fewer dollars in reimbursement for medical care. So
Yeah,
those are their primary issues.
Yeah, I think, Michelle, you've hit it on the head, hit the nail on the head. I think it's really about autonomy, control of dental practice, control of reimbursement and participation in insurance plans, and the fear of losing some of that control by participating in a government program. So that's I think that's the issue. But I think the writing, again, according to Marco at our meeting at the MDA, is on the wall.
Yes.
And so he pointed out to everyone that if dentists want to make a good living in the future, and if they think they're going to count on older people who have a lot of assets and can pay for whatever care they want, that might be true to for the boomers, but it's not going to be true for the following generations.
Right.
And that dental practices are going to have to look to other and be more open to other reimbursement sources.
Yeah, especially as more than 20% and approaching 23% now, I believe, of every dental practice that's not a pediatric practice is elderly.
Okay, due to time, we're going to move on. I know I saw a couple of people in the chat who had unmuted yourself, Betsy, and we love, if you have other comments, we'd love to hear from you later in our program. We'll have time for other chats. So just hold any comments that you guys have. I do want to remind people to put themselves on mute. I do have somebody called meeting participant who I can't individually tell you in the chat because I don't know who you are. But if we can all mute, that would be great, so that Sam's presentation can go on unhindered. So we're going to move on because we just have such a packed program today. I have the pleasure of serving with Sam on the ASTDD Healthy Aging Work Group. Sam has been the chair. You'll have to tell me, Sam, if you still are. I know you might have passed on the baton. I can't remember. But anyway, we have been working the last couple of years on a great project that Sam is going to tell us all about. Take it away.
All right. Thanks, Elisa. Great to see everybody. Again, I know many of you, but my name's Sam Zwetchkenbaum. I am the chair of the ASTDD Healthy Aging Committee. ASTDD stands for the Association of State and Territorial Dental Directors. I am the dental director for the oral health program in Rhode Island. Many of you may know that your state has an oral health program. I would say most states have oral health programs. As I talk about the genesis of this project, I'll explain that it has to do with empowering state governments, and more specifically state oral health programs, and also state aging programs with oral health information. So next slide, please. So I guess this one has the QR code, the web resources. You'll all get this. I won't actually be going to the resource, so I'd encourage you all after today to visit the resource and go through it. I'll just sort of describe the genesis of it. And again, a whole lot of people involved, many people from GSA, some people from state government, people from academia. But we are grateful for funding from the Gary and Mary West Foundation for this project, and also very grateful for our fearless champion, Rory Cafano, who couldn't be on the call today. Rory is our ASTDD consultant for the Healthy Aging Committee. Next slide. So again, as the previous slide said, the purpose of this tool is to provide resources, but how did this all come about? So like I said, I'm in an oral health program. Oral health programs at states are usually, actually every state is different. Some states get funding from the state. Rhode Island does not. We are funded through a CDC grant that is very specific for sealants, water fluoridation, and surveillance, and a HRSA workforce grant that every year, every 5 years differs in what we do. We do not currently have any funding that supports oral health for older adults, but not a week goes by that we don't have an opportunity to interact with an organization that wants to do something for older adults. And they're always asking for resources. Organizations will contact us. Maybe the Alzheimer's program here at the Department of Health will contact us. So the thought was to have, we know there are a lot of resources. How do we get them together? So as this slide says, we had a meeting of the Healthy Aging Committee probably in 2019, where we discussed that we needed these resources. So we developed a small work group that first met in March 2020. We put together a survey of all state oral health programs and state units on aging, just to get input on who might want to participate in the putting together of this resource document. We wanted to hear what states needed. 5 states, Alabama, Iowa, Missouri, actually this is 6, I'm realizing, Alabama, Iowa, Missouri, Nebraska, Virginia, and Wisconsin joined the work group, and we started meeting in December 2020. And I also want to thank Mike Helgeson and Deb Jacoby of Apple Tree Dental. They were the ones that put us together with the Gary and Mary West Foundation for funding for this project. So next slide, please. So we brainstormed topics. We pretty much met every 4 weeks over the Zoom for 2 years. And all the while we reached out to the Healthy Aging Committee, again, including many of you who are on this call, to review the resources we had. The final resource has 9 topic areas. And then there's a section on resources. This was also reviewed by subject matter experts in many areas, and including, this was very exciting, that the U.S. Chief Dental Officer at the time, Dr. Tim Ricks. Next slide. So this, the 9 topic areas you can see here, there's a section on oral health and overall health, a section on special populations oral health needs, tooth loss and oral health, non-ventilator and ventilator-associated pneumonia, nutrition and oral health, financing routine dental care, oral health care and non-dental providers, teledentistry, and an equity approach. And each section has a short narrative with references, and also has buttons of resources. And you can download this and you can click on the resources. You know, the other thing I'll tell you, another product from ASTDD, which many of you may or may not be familiar with, is something called the Best Practice Approach Report document. And some of you may have participated on that. But again, thinking that the Healthy Aging Committee and this work group is here to support state oral health programs. Maybe they've got a grant, maybe they don't have a grant, but to provide examples of best practices. So that document I encourage you to visit also, because we're creating a new one. This is a little bit different. So you'll go to each of the topic areas, you'll read a narrative that'll have some references. And one of the good things, and it has the resources, one of the good things is we can update the resources. So the section on financing routine dental care certainly has a section about Medicare. And so the new resources that the Santa Fe group has come up with, we can make sure that those are there. So it's a good resource. Okay, next slide, please. So we had, the final product was developed in Canva and converted to a PDF. It was posted to the ASTDD Healthy Aging webpage in October, and it's been shared in a variety of ways, including here through the GSA. States have sent it out through aging listservs, the Administration for Community Living, certainly the Gary and Mary West Foundation, and oral health nursing education program. So many that you see here have helped advance this toolkit with the goal of people knowing where some of these resources that people have put a tremendous amount of time so that they can be used. Okay, next, please. So again, I think for the interest of time, I'm not going to have you all, but maybe you can take a second and scan this QR code, and at some point, please go and look at the web page. Next slide. When you do go to the web page, we ask you to take a survey to provide a little bit of information. So here on the web page, you'll see there's a survey that will ask you some information. Just above the survey, where you'll see it says access the older adult oral health resources for collaboration. Here, you click on that and that brings up the PDF. And we'd be excited for any feedback you have on it. Then make sure to do the survey. Okay, next, please. So some next steps, we're sharing this as much as we can during Older Americans Month in May, this past month. So many of you know Chris Wood from ASTDD. She sends out a weekly blast, and she has included this in the blast. State dental directors, I'll be honest with you, change fairly frequently. Oral health programs change very frequently. So ASTDD providing that service of regular information is important because many people are new, and to be able to get this information. We encourage you, once you've seen the document, to share it with those who work with older adults. We did a roundtable at the recent National Oral Health Conference. And of course, this meeting is an opportunity to share. Any input that you have, please share. Like I said, Rory, we can't get on and change it every day, but if people see new resources that they see, that they say, hey, why don't you include this? Or even more important, if you see a resource that's there that's no longer working, please let us know. Next. Here's my contact information and also Lori's, but like I said, I've given you a little bit of a teaser. Again, understand the background. This is for so many who are looking for resources, and we don't want people to have to reinvent the wheel. We want people to know that there are some wonderful resources out there, and just make it easy for everybody. Right? Thank you very much. Any questions now?
Sam, not to put you on the spot, but you had mentioned the various states that you had worked with collaborating. Can you give us any insight into kind of what their plans were in terms of utilizing this? Can you give us kind of real life application?
That's a great question. I know that Nebraska had been putting together a program to train CNAs in nursing homes. And it almost did seem like they were reinventing the wheel of something that was already out there. I know here in Rhode Island, we're doing a project to educate home health aides on oral health. And we wanted to be able to pull something. We actually ended up pulling something that was developed by the VA. So that might be an example. If people are looking for trainings for CNAs, just to know what's out there rather than trying to develop it on their own. There's other information, just some data sources. I'm actually pulling it up myself. Some information on ventilator-associated pneumonia. People could use some of these if they're going ahead and writing a grant, if they need data to support writing a grant. There's a section on nutrition, on healthy foods for older adults, we work very closely with Harvard, and I saw Stephanie Shuman on the call. We were really lucky that she had some geriatric dentistry fellows who were able to really put together some nice graphics that state programs, rather than having to reproduce it themselves, can go ahead and download those and have them for events. So again, and again, thanks again to Stephanie, because I know her residents, her fellows felt like they were going back and forth so many times, but getting that input from so many people make these resources valuable.
And I think that's such an important point in terms of, you know, kind of, Steve said Michelle's the grandmother of geriatric dentistry. You know, I'm starting to feel a little old myself, you know, even being a few decades younger than some of the older ones around here, but still us over 50s are a lot, and we don't have a lot of young generation coming up. And so I think, you know, Stephanie and the fellows that she's got are so critical, and getting them engaged in the projects that we're doing, and finding other things. That's going to be kind of a theme that we continue on with some of these other presentations. You know, how do we engage the next generation of researchers and academicians, and getting them involved. Stephanie, do you have any thoughts from having been a part of the project? Again, not to put you on the spot, but I am.
Hi everybody, it's very great to see you. So yes, as Sam mentioned, the students were thrilled, and especially because they did their field experience over COVID, so it was a good merge to do it virtually, and they got to know the organization and how to make it work, from brainstorming idea to all the feedback that they received from the experts. So if anybody has any projects, I have a number of students that are always willing to collaborate, especially on rural areas or aging. So just, I will put my email in the chat, but we're very thrilled that it happened. And I know what mentorship is very important. I have been a mentee, and I started with ASTDD in 2012 as a mentee, and now I am mentoring, so I know how important. And Dr. Saunders also has been my mentor since 2009, so thank you very much. So I know how important is that, and we're working on different venues on aging, so just let me know, just reach out if you have any ideas. We have a grant for rural communities, so we're trying to, and we're going to be receiving 3 new students, so they are going to be looking for projects related to rural older adults and health centers.
Great. And again, that's what's wonderful about GSA, because we bring in not only, you know, the geriatric dental component, but we also bring in all of these other experts from different fields. And I know at our oral health interest group meeting in November in, I believe it was Indianapolis, you know, there was someone there from, I don't remember, I think she was OT, and she wanted to do a writing project in her area to give insight on oral health for the aging, a geriatric dental perspective. So again, that is a great project for a student to do. So again, as we kind of put our thoughts on it, people come to us asking about projects, again, helping to facilitate, to find providers who can be that geriatric expert on those projects. So Stephanie, I might actually connect with you on that project. That would be a great student project. But again, we all have connections like that. And I think engaging the next generation is absolutely huge. And with GSA, we have the opportunity not to just engage within the geriatric dental world, but also across disciplines. And it's such a wealth of collaborations. Okay, does anyone, we have time for maybe one more question, and then we'll move on to our next speaker.
Lisa, there's a question in the chat on what's the current status of oral health surveillance of older adults. How many states have conducted a survey? Do you know that answer, Sam? Or anybody else?
You know, I don't know it offhand, but a number of states did obviously prior to the pandemic. Rhode Island has done a couple, but I haven't heard discussion of any that have it planned currently or in the future. But I can
And
get
again-
that. If anybody wants to take my email down, I'm happy to look into it further.
What's nice about, again, what we try to do across all of these organizations is, Sam, you can kind of give more clarity on this, but ASTD has, what is the program that when people do these surveys, we're all kind of using the same,
Yeah, it's the basic screening survey. So ASTDD, so like I said, most state oral health programs that have funding have CDC grants that only support basic screening survey for children. Unfortunately, currently CDC is only I shouldn't say that. Hopefully in future endeavors, they'll realize full life course, but ASTDD, which is the support organization for state oral health programs, did establish a basic screening survey for older adults. And some states have done it for older adults in long-term care settings, and some have done it in community dwelling settings through senior centers. But yeah, it's called a basic screening survey and looks at various items.
exactly. So it's important to realize, yeah, don't reinvent the wheel. There's something that's out there that also then will allow you to compare your data to others as well. And again, as Sam indicates, it's been used in a lot of different, for older adults, where we do our surveys really do matter, and you'll get different results, whether it's community dwelling versus long-term care, et cetera. But there is, data on all of that. So
yeah, and then
ASTD
Elisa, the last thing I'll share before I leave is the Healthy Aging Committee subgroup is now working on an updated version of the best practice approach report. And we're grateful for many of you who on this call who are either participating or will be asked to review. So please watch out for that resource as well.
And Sam, before you leave, I wanted to just say thank you very much. You and Rory are always available for GSA when we have any questions, and you run great meetings. So encourage other people to join.
All right.
Thank you.
Thank you, everybody. Okay.
Wonderful. We are going to move on to our section that Steve is going to be presenting.
Yeah, I'm here.
All right, so yours, Steve.
Thanks, Elisa, and thanks, Sam, for that great review of ASTDD's work. Yeah, we really appreciate this type of collaboration, not only among professions in GSA, but among within our own area as well with organizations like ASTDD. I'd just like to update you all briefly on our GSA planned activities for not only for our upcoming annual scientific session in November, but also some other resources we're working on in the pipeline. Next slide, please. First of all, I want to let y'all know or remind you that our next GSA annual meeting is going to be in Tampa from November 8th to 12th. And on Friday, November 10th, we've got kind of a packed oral health day, including a momentum panel discussion. Those are large sessions, discussions that are that each different interest areas or topic areas can present at GSA. And we've been fortunate to be able to do those in the past. We like to select or focus on a hot topic, and we'd love to hear from you folks too. What topics would be of interest to you to hear about. You can either type something in the chat or send that to us later as well. But we're still identifying or deciding about a topic. So if there's something burning on your mind that you'd like to hear about, please let us know so we can consider that. We'll also be having our Oral Health Interest Group Symposium that day, which will be on oral health interventions and treatments for older adults with cognitive impairment and diabetes. And so that symposium is planned for that day too. There will, of course, be lots of other papers, and another symposium on oral health topics on the other days of the GSA meeting as well. So there's lots to think about and to consider attending. At the end of that day, we'll also have our next oral health interest group meeting and reception, and we're looking forward to the plenary session for the GSA meeting. The opening plenary session is going to feature New York Times columnist and best-selling author Frank Bruni, whose popular 2022 book called The Beauty of Dusk, of Vision Lost and Found actually details his struggles with sudden onset blindness in one eye from a rare form of stroke, with the possibility the same thing could happen in the other eye as well. And this drove him to look for comfort and wisdom by interviewing other people who had suffered similar losses, including some losses that we often associate with the aging process. Again, that should be a great opening plenary session, and we would encourage you to think about that. The meeting registration is open at this point. And certainly if you're not a GSA member now and you want to attend the meeting and get a discount, please think about joining us, not only for a discount, but also to be able to help us in our interprofessional efforts to improve oral health in older adults. Again, many of our activities and things like our interest group meetings and receptions are graciously supported by Halion. Kim Adanazi is here. We want to tip our hat to her for Halion's support. And Elizabeth Brewer, if she's here, I'm not sure if she's one of those meeting participants or not. But Kim, we want to tip our hat to you for your help in our activities. Next slide, please. A couple of new and pending resources. I want to first call your attention to an ADA symposium on improving oral health care in the aging population. This was originally held back in August, but has now been packaged and is available from the ADA as online for CE credit. That symposium included presentations that we provided on our GSA oral health initiative outcomes, as well as our recent work on dental provider and payer perceptions of value-based oral health care, in which we partnered with Discern Health to work on that. And that was again supported by Halion. And information on that initiative, that work on value-based oral health care, can be found on the GSA website. We're also now planning a podcast to discuss some new resources that I actually was involved in developing here in Minnesota on creating dementia-friendly dental practices. This is part of the Act on Alzheimer's program that we have here in collaboration with our Minnesota area agencies on aging, and was supported by our HRSA-funded North Star GWEP, or Geriatric Workforce Enhancement Program, and the Minnesota Dental Association, along with some support we also obtained from Delta Dental of Minnesota Foundation. So our package of materials, you see the web page over here, which says for dental providers under Act on Alzheimer's. The package of materials we developed includes 2 educational programs, which is one for all office staff, including administrative staff, about basics of dementia and communication and interaction. And then we have an advanced training program for clinical staff, which is more intensive. We also developed a great dental provider practice tool for quick reference in the office. And we have video tutorials included as well on how to share concerns with patients or others about possible cognitive problems, as well as how to assess decision-making capacity. So please stay tuned for that. We're planning again a podcast to discuss that and provide some more information about it. I don't know if Elisa, there's any questions right now, or should we move on, do you think?
You can ask questions now. We have some time.
Okay, we have a little time. Any questions on GSA activities or resources? Be happy to field those. or we can field them later too.
I would be interested in hearing, again, we're really trying to get things out there and accessible for people. How are people using the resources? Are you able to find them? What is helpful? Are there ways that you can share what you're doing that can help other people think about ways that they can tap into these resources? Any thoughts in that regard?
Yeah, I think, clearly, I mean, the beauty of the web is that people can start to cross-link and post resources. I mean, for example, our Act on Alzheimer's materials, the dental provider package is certainly, available online. There's information not only on those tools that I mentioned, but also how to arrange training if people are interested in doing that. And so I think it's a matter of getting things posted too, so people can find them, on different, because, I do think, Elisa, we know that there's just a ton of potential places that people are tied in and may go for resources. So, I mean, I think what helps us too is just hearing from people where they'd like to see things posted, so that they can access them easily.
Yeah, and Elisa and Steve, we also have a spot on the GSA oral health web section. We're trying to be a good hub. So
Right.
if anybody on the call has materials that you would like to be added to our hub, let me know. I did see something was noted in the meeting chat that we will be sure to be adding. So send it my way and we'll get it on up.
Anything else? Or I see there's a hand up somewhere here I see on my meeting participants, but is there someone who has something they want to offer?
Yeah, hi. I don't know why my name isn't showing up. Neither is in any part of my body but my hair.
Yeah, but we see the top of your head.
Hello. This is Helene Bednarsh, and I put in a couple of resources for May because of Older Americans Month. We did a webinar on ageism, and I put the information in. It's a link to HIV, but not HIV dedicated. And the women that did it had incredible examples of language and how words matter, as well as designs of dental facilities. And so I put that in. It's from May 10th at neaetc.org if you don't see it. And one other group I'd like to mention partnering with is there's an inter-CFAR HIV aging work group. For those maybe not familiar, a CFAR is the Center for AIDS Research. And there's, I think, around 10 or so across the country, but we have one HIV and aging work group only led by Emory in Miami CFAR. So I put the contact in that, and part of that is not to just focus on one population, but if you look at HRSA HIV/AIDS Bureau, most of the more than 50% of our eligible clients being served are over the age of 50. And so we're not really looking at HIV as much as comorbidities. So I just wanted to be able to share that with you. So thank you.
Great.
And there's another comment in the chat about resources. It says, would you consider the creation of an app, web-based or freestanding, for these resources in the same way Lippincott does Oral Path? I don't know what that's relating to or suggesting. Does anyone know? So if you want to follow up meeting participants with a more detail of what you're asking for, that would be helpful. I don't know that we're familiar with that, like a link for where we can see what you're
And I put my email in there, K Tracy. They can reach me and talk more about it too.
Perfect. Yes, connect
Great.
with Karen. Awesome. All right, I think we're going to move to our next section here, which is kind of a recap of the meeting within a meeting that happened at the American Association for Dental and Oral and Craniofacial Research meeting in Portland. So without further ado, I would like to invite Chris Fox to kind of give us an update on that meeting.
Great, sure, Dr. Ghezzi, can you hear me okay? Yes, okay.
Perfect.
Great. I'm Christopher Fox, the Chief Executive Officer of the American Association for Dental, Oral, and Craniofacial Research, as well as the International Association for Dental Research. And thank you, first of all, for inviting me to participate in this oral health interest group and to give a recap of our meeting in Portland. So some of you who may be longtime members of our organization will notice we have a few more letters in our name. And we recently expanded the name AADR to be AADOCR. That is really to reflect the breadth of research that our members are currently doing, much like NIDR expanded their name to NIDCR about 25 years ago or so. It just took us a little bit longer to do it ourselves. But we want anybody that is involved in dental, oral, or craniofacial research to feel that they have a professional home within AADOCR. So it wasn't just a name expansion, it was really to put a greater emphasis on the science. And we had a large initiative called Science First. And part of that Science First initiative was to have this meeting within a meeting concept. So the first one we had was in 2022, and that was on artificial intelligence. So this idea came to us from some folks that were on our task force that also were in various chemical society and chemical engineering groups that have this within their meetings. So we just sort of adopted it. And it's really to have a focus on a specific topic throughout the meeting that will draw people from other disciplines to our meeting and also expose our own members to a topic with some breadth. So again, in 2022, we had one on artificial intelligence in dentistry. And this year, in March of 2023, at our Portland meeting, the meeting within a meeting was aging and oral health research. And this was led by our then president, Jane Weintraub of the University of North Carolina. And it was supported by Halion, a name you've seen before in this webinar today. And they were terrific supporters. I should add, though, that they're very strict with physician sunshine laws and the like. So lest you think that they had any influence on the program, they did not. The program was fully developed, and we just floated it by the key players at Halion if they would be interested in helping us support the meeting, and they were. But I do want to be clear that it was an unrestricted educational grant to AADOCR to help sponsor this meeting within a meeting. So if I can have the next slide, please. So our meeting is a 4-day meeting, Wednesday through Saturday. And this meeting within a meeting was over 3 days, Wednesday, Thursday, Friday. And it was 3 sessions of 90 minutes each. So on day 1, we sort of set the stage with the biologic mechanisms of aging and oral health, and using the NIH term that's coming out of National Institute of Aging and other places on geroscience. And true to how we want to run these meetings within a meeting, we reach way outside of dentistry and oral health research and have a keynote speaker. And this was Matt Kibberline from the University of Washington, Seattle. And he gave a magnificent talk on the biologic mechanisms of aging and how aging is a risk factor, orders of magnitude greater than any other risk factors, we think, for all sorts of diseases. Very elegant presentation. And then we drilled down, pardon the pun, to more oral health presentations. And we had Keith Kirkwood from the University of Buffalo talk about oral cancer and aging, and Mark Ryder from the University of California, San Francisco, and some interesting research that he's been involved in on Alzheimer's and periodontal disease and the association between certain bacteria in periodontal disease and also found in Alzheimer's patients. If I could have the next slide. So we started with the basic biologic mechanisms on day 1, and on day 2, we transitioned to behavioral and social aspects of aging and oral health significance. And we had a fantastic MD, PhD researcher from the University of California, San Francisco, Carla Perisanato, and she gave a keynote on behavioral, social science, and health services research aspects of aging. Some of you on this call may know her work. She is quoted, she has a book, and she's quoted in some of the consumer publications, and a bit of an expert on loneliness and aging. So she touched on that in this session. And then we had two speakers, more from our community, but Bei Wu from NYU College of Nursing, speaking on the research that she's been doing on tooth loss and cognitive decline. And then Riva Tucker-Decker on oral health and nutrition in aging, and she's from Rutgers. And then if I could have the next slide, please. Day 3 was on research and training needed to improve the delivery of care for older adults. So here we had 4 speakers, including Dr. Ghezzi, who you see here on your screen, talking about the delivery of care in institutional and home-based settings and the research that is needed. We had Lyubov Slajeva from Appletree Dental speaking on an approach from the dental provider network, the research needed. I see she's on the call also. And then we had evidence for coverage of oral health services in aging populations and research needed with Natalia Chalmers. And I'm sure you're familiar with her. She's the sole dental person at CMS, and she's very much an internal advocate for some of the things that Dr. Shuman and others have been talking about. And then we had our director of NIDCR, Rena D'Souza, talking about future directions for oral health research and aging. So it was very good to have the funders there to see what the research is, to see what the gap is, and spur some ideas. And she gave a very nice talk also. And the next slide, in terms of next steps, the Jane Weintraub, our now immediate past president, and we had a chair of each of those sessions. I didn't put it on the slide, but Kathy Atkinson, Yvonne Papilla, and Chen are the co-chairs of those 3 sessions, and they're working on putting together like a summary presentation of this. And that will be published in the Advances in Dental Research, which is a sort of a sub journal that we have under the Journal of Dental Research that's specifically for meeting proceedings. And that should be coming out probably in the next 2 to 3 months. I know they're still working on pulling that together. So that is the meeting within a meeting, and thankfully we will be publishing the proceedings. And in addition, all of it was recorded. So if you are if you attended the Portland meeting and paid a registration fee, you have access to the recordings right now. You might have missed 1 or 2 or maybe all 3 of these sessions because there's so many competing things happening, but you can go back and watch the recordings, which I would strongly encourage you to do so. And if you're a member but did not make it to Portland, there's a reduced fee where you can actually view these recordings as well as everything else that happened at our meeting. And if you just go to our website, you can find out how to access those. If you have any questions, feel free to email me directly at cfox@iadr.org. And then separate from the meeting, but I do want to call to this group's attention, the next slide, please, that we're working on an aging and oral health special issue with our guest editors, Bei Wu on the call and Ana Paula Vieira Colombo. And we're working on pulling that together, and everything, about half of it is already up online first, including a nice paper from NYU Bei Wu that's online first right now. We've got, I think, 1 or 2 papers that are still in the peer review process. But once all of those are in, we will have a special print issue on aging and oral health. So I want to put that on your radar screen now, but also if you go to the Journal of Dental Research web page and look at the online first journal, you'll see about 7 or 8 articles that will eventually be in the special issue are already published. So that's it from the meeting within a meeting and the AADOCR update. And then we would like to have a sort of a panel discussion with Dr. Chen, Wu, and Ghezzi. And I will first ask if there are any questions from any of our panelists or participants or anyone else on AADOCR in the meeting within a meeting, and then we'll turn it over to have a general discussion on why this is such an interest to AADOCR and what we'll be doing going forward. Okay, okay. Helene, nice to see you. At least I saw the top of your head earlier. I've known Helene since my Boston days about 25 years ago. We won't say exactly how many years ago that was, But yes, I already mentioned that the sessions were recorded, and if you're a member, you'll have access to that.
So you've got the people that you need up on the screen now.
Okay, great. Well, who would like to kick this off? Maybe I will turn it over to Bei Wu, and she can talk about the importance of the meeting within a meeting, and also maybe touch on the upcoming special issue from JDR.
Thanks, Chris. Can you hear me?
Loud and clear.
Great. Yes, thanks, Chris, for mentioning this special issue, JDR special issue, that we currently, Anna and I are writing an editorial for this special issue. And hopefully this, and we actually, the most updated, the most recent update is all the papers has been actually accepted that like based on like previous revisions, etc. So we have, I think, close to 17 papers that will be included in the special issue. And we are writing an editorial, so it should be up. This special issue should be up hopefully in July. So that's our plan. For this the meeting within the meeting, that for the second day, the theme is behavior and the social science aspect of aging and the oral health significance. As Chris mentioned earlier, that our keynote presentation was from Carla Parisanedo from UCSF. That her topic is on loneliness and isolation in older adults, medical and the public health perspectives. So as the U.S. Surgeon General under two different presidents, Velk Murphy spoke of loneliness as a public health epidemic, and even wrote a book on this topic. So in Carla's presentation, that as a clinician, she gave us a really wonderful kind of 4 case studies, presented 4 case studies that based on her kind of personal encounters as a physician. These the 4 case studies related to older adults who experience loneliness during COVID. And she also provided the definition of loneliness, and particularly think about what are the kind of measures of loneliness and the social isolation. These are 2 different concepts, although they're strongly correlated. The measurement of loneliness is a self-reported sense of being lonely, while social isolation is more about kind of objective measures of isolation. So she mentioned that how this loneliness and social isolation on the negative impact on health outcomes for older adults. And also think about how to translate these kind of research findings related to loneliness and isolation into healthcare practice. Loneliness is really based on actually Murphy just 2 weeks ago published a article saying that almost like half of American adult population in the United States had experienced some sense of loneliness previously. So this is that is such a public health epidemic that facing in the nation. So that's how we can kind of think about, so Carla's kind of presentations, how we can strengthen our ongoing education and training to address this issue, and how can the role of social prescribing that actually can play a role to address this, particularly, for example, direct interventions related to how to provide social support, how to enhance interactions among older adults, and address kind of maladaptive cognition. And the indirect interventions is think about how we can address this kind of vision, hearing, and the functional needs of older adults that could potentially have an indirect kind of benefit to address loneliness and the social isolation. She also talked about some policy changes, think about how we can actually at the community level to develop community-based programs to as well as the kind of peer support among older adults, as well as how we provide caregiver support, because caregivers are particularly vulnerable in this after COVID, how we can provide support for caregivers to combat this pandemic,
Right.
as an epidemic. Think about
Right.
social isolation.
Well, there's some truth to that slip of the tongue, because obviously the pandemic did exacerbate the loneliness issues in many, across all ages, really, when things were on lockdown. So I'm sure that's addressed also in Vivek Murthy's book, although I have not read it. Let me turn to, I'm not sure how much time we have, but I want to make sure we have enough time for Dr. Chen and Dr. Ghezzi. Any impressions from the meeting with their meeting, any take-home messages that you'd like to emphasize? Let me start with Dr. Chen.
Yes, we have plenty of time, Z. Keep talking.
Okay.
Okay, great, thanks.
Okay, so Chris already made a great summary about the meeting within meeting. I just want to provide a few updates regarding the proceedings, because I'm working with Jim Van Chop and other section chair to develop this proceeding. And then right now we have received abstract from all the presenter except for Dr. Natalia Chambers, which we don't have a permission from CMS to include her presentation into the proceeding. But I think she discussed about the evidence needs to support the coverage of all health service for older adults. But I think it's a great presentation. You can hear her presentation from the recording. Right now, as far as I know, these proceedings will be published only on in an online format.
Correct.
And then there's no paper-based paper coming out.
Correct.
And then the editorial board already approved the cost of this publication.
Right.
And we already, I think a few reviewers has been identified in contact. And right now, Jen and the team are just working together to integrate all the abstract together and also develop the discussion section. And the deadline for submission, I think, was extended. I mean, previously it was like early May, but now it's extended. I cannot remember when I tried to find out the day, but I was not able to find the day. But I think it should be soon. And we are right now, we are just working on a couple figures to be included into the manuscript, which summarize the oral health change and the lifespan, something like that. So
Great. Super. Dr. Ghezzi, would you like to give your impressions of the meeting within a meeting?
Sure. Yeah, Chris and I have actually been talking about this, I think, for about a year and a half, when he originally approached me about, hey, we're going to do this meeting with the meeting. And so, again, to me, it was, oh, what a wonderful opportunity, not just to have this presentation at a conference, but again, all that goes on. We've discussed the publications, but also there's the collaboration and the ideas and kind of what happens after that. And I actually want to give a real life example. I was able to meet Bethy Turton, who was there. She's currently at Boston University. I want to ask her to just pop in real quick. And I've had a couple meetings with her discussing, what she's doing. She has an R21. Again, we're talking about, let's increase this grant funding. I'd like her to kind of talk about what her R21 is. And she also actually has another publication that she is coordinating that could use some collaboration. So Bethy, do you want to give us some insight on both of those? Because this group would be a great group to be able to contribute. Are you out there?
Yeah. Can you? I think I'm coming through okay, aren't I?
Yeah.
I think for the shout out, and just want to emphasize that this meeting within a meeting was such perfect timing, because I'm relatively new to the field around older adults in long-term care, and I was really able to meet a lot of the rock stars. So to cut to the chase, we've recently received funding under the R21 mechanism to basically co-design a preventive intervention for older adults in long-term care. So we like to think that it's the beginning of a program of work around older adults in long-term care. And as such, we have had the chance to get a special issue with the International Journal of Environmental Research and Public Health. I'm just going to put the link into the chat. Basically, we're looking to solicit articles on innovative approaches to supporting older adults in long-term care. So we're going to hopefully submit, the results of our scoping review, which look at the existing evidence around the burden of disease among this group. But we'd welcome anyone that has some commentary to make around the experience of older adults in long-term care. Essentially, what we're hoping to do, and with all of your input as well, is just try to shift towards a preventive paradigm when it comes to what's happening for older adults, specifically around preventing what we are hoping to characterize as some version of a crisis event. So that's the crisis event is yet to be a moot point, and this is the reason why we're hoping to engage the broader community in discussing these innovative approaches. So that's my 5 cents.
Again, and such a wonderful example of what happens through these meetings. And again, if other people have other examples of, topics that they're pursuing, what was so critical about that meeting was, we don't want to talk about just what we're all doing. We all know what we're all doing. What is the aging world doing, and what are some of the themes of their research? What I'm interested in, some of the stuff that Bethy's doing is she talks about crises events. I don't know that I've heard that term used in geriatric dentistry quite so much, and again, equating some of the work that's done broader in the geriatric world into themes of geriatric oral research. So those are some of the things that we want to continue to do post this conference. Again, they discuss the topic of loneliness. There's a lot of things that really can be pulled from a broader multidisciplinary collaboration, and excited to see some of that starting.
Yeah, I'm glad you brought that up, and thank you, Bethy, for that intervention. That was definitely one of the unwritten. Sorry, somebody else talking? Sorry, I was getting some interference. But one of the aims of this program also was to attract a workforce to this area. Where the workforce is, in terms of the scientific workforce looking at these issues, it's basically people on this call and a few others, but not many. So we do want to be attracting people from other fields, from the broader gerontology sciences to oral health, because we have some very challenging issues in front of us. So we need a greater workforce.
So that's a good
Sorry,
point.
sorry.
Yeah, again, Bethy, in talking with her background really is working a lot with cardiology and in kids, and has now kind of expanded in that direction. I think Margarita Fontana has done a lot of work with silver diamine fluoride, and she's starting to look into kind of the geriatric population as well. And so we're looking at some of our colleagues around our dental schools of what are they doing, and what is kind of a oral health for the aging application of that, and how can we collaborate with them. And I know, Jane Weintraub has collaborated with Judy Jones at the University of Detroit, looking at some data actually out of the University of Michigan. And so again, you don't have to be, Jane's at UNC, so you don't have to be anywhere near your data. Data can come to you. And so really looking at some of those, institutional collaborations as well, because we need them. And again, pulling in our next generation. And Bay does a great job of that also. Again, Steve talked about the symposium that are going to occur at the GSA meeting. A lot of those abstracts are submitted by students that Bay mentors. And so again, just encouraging more people to find students that can pick a topic in geriatric oral research as well. Really
And
appreciate.
Can I just ask, Lisa, where are we on geriatric dental residencies? Do we have enough for the coming growth in the aging population? Is that something that maybe GSA and AADOCR and some other groups could advocate for? Where are we? I get the sense that we're not going to have the workforce that we need for the future.
This is Steve Shuman. I'm
Excellent.
happy to pitch
Please.
in on that. We are struggling.
Yeah.
You know, in terms of recruiting, we're struggling to recruit a lot of different disciplines into advanced training these days. But certainly, you know, geriatric fellowships, special care fellowships, things like that are hard for us to recruit for. There aren't still a lot of programs, and it can be difficult to convince students to pursue additional training, especially when they come out looking at high debt loads and things like that. So I think that is something that needs some attention. You know, I would have thought, you know, having gotten involved in this 35 years ago, that we'd be doing better by now. This is an issue in medicine and other areas of aging training as well. So it's difficult to attract geriatric fellows into medical fellowships as well.
Yeah, and I forgot what organization it was. I don't think it was GSA or AADOCR, but you had posted something, Dr. Shuman, about an opportunity available in Minnesota, and you got a lot of pushback. Like, well, we don't need this.
Well,
I mean,
yeah,
it was really shocking.
Apparently, we got pushback from initially from a person who was questioning, you know, whether we were launching into a new specialty area or creating a new specialty area. And of course, that wasn't the intent. I think most people who responded, you know, kind of called that out. But the fact of the matter is, we continue to see an increase in the number of individuals in the community, whether they be older adults with special care needs or younger adults with special care needs, who are struggling to find care. Yeah. And are just grappling with some very difficult access issues. And I think that unless we have more folks out there who are able and willing to do the care, we're gonna continue to struggle. And of course, at the root of a lot of that is financing, you know, is reimbursements and what's available for the extra work you have to do to provide this kind of care in a skilled way.
Absolutely.
Yeah, and Chris, you know, it's an international question. Chris and I were in Geneva at the FDI meetings, you know, last year, and that topic actually came up. And one of the answers I gave to that was exactly, you know, we can train them, but do they have jobs when they get out? And really having the ability for those who might be interested to see the sustainability of such a career. I think that's definitely an issue out there. That's limiting our ability to recruit. But at the same time, again, you know, one doesn't just have to go to a 2-year fellowship program post-residency, like many of us did, where, again, I know Bethy connected with Steve, who has his 1-week, you know, geriatric dentistry mini residency. You know, Minnesota is known for those. And so, again, being able to connect our colleagues who, you know, just kind of want to get a little in of, hey, what, you know, with Bethy converting from doing work with kids to adults, you know, understanding that long-term care world really well. You know, if you don't have 2 years to invest, at least spending a good week in Minnesota learning just so much that will impact how you're able to do both your research and clinical care, I think is huge. And I was encouraged. I do some work with students all over the country, and and recent grads. And so I have someone who's at an FQHC in South Dakota and one in Michigan working in a private practice who, you know, were friends in dental school, and they were going to go to Minnesota to do the mini residency in pediatric dentistry. But just, again, talking to those young people that we know about, you know, even if they're not going to do a postgraduate program, some of the great opportunities out there for education to spend a week to go do that. And so to me, it was neat to see that, okay, these recent grads felt like this was something that was important enough that they would take a week off to do that. I think we underestimate the importance of things like that. And again, Steve's program is awesome. I did it in 1995. It's been going on forever and has had such an impact on so many people.
You know, Elisa, I just wanted to mention, you know, at our last course that we did here last October, we actually had 5 students, fourth-year students from a dental school in Nebraska who came to our course. And the reason they came, they said, was because they felt like they needed more information about this kind of care. And one of their faculty had done our course, our CE course. And so they arranged for themselves to come and do our mini residency. And honestly, on the first day of the course, when everybody introduced and we found out who they were, we all stood up and applauded them.
Yeah, that's great.
Actually, I have to tell a story at AADOCR when I was sitting in the Halion, beverage booth. They're chatting with people. There was a student from California who was discussing with me I want to know more about geriatric dentistry, but I don't have the connection. What I'm getting from my school is very limited. And so the students are really recognizing this. And so, I think the dental schools are doing what they're going to do. I think there's a question of, is there another opportunity to give them? The student was part of ASDA. And so I've been kind of throwing that idea around in my head of just how can we connect with the students through ASDA and those who just want a little bit more, creating something that, again, will their schools let them spend a week with Steve? That would be huge.
Yeah.
And we've got it already, because that's the piece is, I've kind of mentioned that within my institution, which isn't exactly geriatric friendly. And they're just like, yeah, we don't want to put money toward anything like that, Elisa. But again, let's not reinvent the wheel. Steve already has this. How can we connect this younger generation that really is asking? They're seeing, I'm not prepared to provide care to this population, the aging group. And I think needing to recognize that and help them connect. And again, I think through ASDA might be a good way to do it.
Right. Well, you brought up pediatric dentistry, and I think it's illustrative to look at that population. And we have actually seen improvements in children's oral health by a number of metrics, but it's been there have been several federal policy levels that have made that happen through, the Children's Health Insurance Program, through the Affordable Care Act being inclusive of pediatric dental care, and also HRSA funding pediatric residency. So there's been a concerted effort to improve the oral health of our children, and we've seen that. We haven't seen it at the other age spectrum. So I think we do need, as Dr. Shuman said, at the policy level to improve oral health and aging.
And Chris, this is Karen Tracy. GSA would welcome the opportunity to work with you on this issue.
Great. And next week, is it next week? Yeah, next week, the opening of the World Health Assembly. They will be talking about as part of the NCD agenda, non-communicable diseases, there is a global oral health action plan that we predict will be adopted by the WHO, and that does include oral health through all life stages. So if you read that document, the Global Oral Health Action Plan, you'll see some things in there also. So we have a lot to learn from some of our international colleagues as well. Anything else, Dr. Chen or Wu? Otherwise, I'll turn it back over to Karen Tracy.
No, we are good.
Okay. Back to you.
Thank you, Chris,
Thank you
for joining us. Yeah.
Elisa, I'll
My
send
pleasure.
it back to you, Elisa and Michelle, to continue this discussion. It's been wonderful. Chris, always wonderful to work with you. Always great.
Thank you. My pleasure.
And again, I think, you all can see just the themes of just the collaborative work that GSA is doing with other organizations, and really want to continue that, because that synergy just is amazing in terms of what we're able to create and plan, and each of us bringing our expertise to the table. It's been such a pleasure working with Chris and Jane on this project and seeing it just come together and be such a wonderful resource of information and connecting us broader in our understanding of research in geriatric oral health is much broader than just people teeth. It's really a much bigger geriatric component to it. Okay, I want to pass the baton on now to Michèle, who's going to lead our discussion here. You're on, Michèle. Oh, unmute yourself.
Thank you, thank you, thank you. We don't want to be muted. Again, this is an opportunity for us, for you to, having had a few moments to start thinking about what our momentum discussion topics might be, to sort of have that as part of our discussion. And it's also an opportunity for you to ask questions of any of the speakers and to raise any topic for general discussion. So at this point, I think that would be a really good thing. You can unmute yourself to make a comment or to ask your question.
Well, I'm never one to be very silent, so without anyone else asking a question or making a comment, I'm again referring to the May webinar that we had on ageism, HIV, oral health and all. And what impressed me is because there's been a lot of concentration on how words matter. We've seen a lot of that in the LGBTQ community in terms of addressing patients. And what was really good in that webinar were the contrasts in how older patients are approached and how they may rather be approached. And that might be a good topic to include in some discussion or future webinar. And I will mute myself.
Does anybody want to address that?
I think it's an excellent point, and I think I think just in the past year, if I think about, you know, words and phrases and controversies just within the geriatric world, again, there was a piece of the AADOCR presentation that was a little controversial because, as Chris mentioned, you know, there was, I think, was it the keynote guy who said that, you know, aging is a risk factor. Is aging, you know, disease or not? Those are good discussions to have. And I think there's also been some controversy over how WHO wants to categorize aging in this aspect as well. And so words matter. And I think discussions about words are important. And I think I've heard within our GSA discussions a number of times bringing this up. And there's, you know, there's different sides to it. I think the dialogue is important. And so I agree with your recommendation. And I think, you know, that might be something worth looking into in terms of addressing, you know, again, what's nice about GSA is we don't have to just do oral health presentations. You know, we can take a topic and we can collaborate with all the other people within the organization that are interested on that topic, which again, I think this theme is much bigger than us, but I think we can contribute to it. So
I completely agree with you on that. And Karen, you might want to make a comment here as well. And that is that GSA is addressing the whole paradigm of transforming how we think and talk about aging, and the whole stereotypical inclusion that WHO did with actually referring to aging as a disease. It's like the old pregnancy was a disease. And so we have worked at GSA to overcome those kinds of things. You want to talk about that for a moment?
Sure. Fortunately, WHO has modified that, so it's not a disease
Yes.
anymore.
Yes.
But GSA has the National Center to Reframe Aging, or NCRA, and it's all based on research of Americans on how they perceive of aging and what are good metaphors for communicating forward. Because when we say certain terms, it puts ourselves into a certain mindset of what we think of and how we perceive older adults. Certain languages, certain words perceive an older adult as being old and frail and not competent, and different words such as older adult or an older adult at a certain age is a lot more positive speaking. So I refer people to our part of geron.org, and I'll include that information in the chat to better understand what it means. It's a whole language perspective change, and it'll be a generational issue because our bias is pretty much built into who we are. And as we look to change the dialogue, we also have to start with ourselves first.
Yeah, Karen, it's exactly what went through my head. So I put the links in the chat. Not only the GSA National Center, but the overall, the other, kind of main initiative that's underway. So the concept is reframing aging, and that's what GSA as well as other organizations are involved in.
I think you'll see that if you're interested in submitting articles into our own publication, there's information on how to present the articles so it is not biased or framed incorrectly. So we're starting with our own articles, but the NCRA team is traveling nationally right now. That's why Trish, who oversees that center, is not here. She's been in Salt Lake City, Utah. She's currently in Chicago talking about it, and done quite a bit of work in Pennsylvania, and a lot more that I can't even begin to tell you at this point in time. So there is a movement to better understand the right way to position older adults and to communicate more effectively, really to facilitate appropriate policy change as well. Back to you, Michelle.
Yeah, we couldn't neglect that. It's too important, and it's so relevant to all the research issues we've been talking about.
Definitely.
Can anyone else chip in with conversation or questions?
Yeah, we do want to especially invite, a number of you were involved in a lot of the projects that we did discuss today in terms of the AADOCR meeting. I know, Luab, if you want to, comment on anything from your presentation. Also want to invite Kim Atansi as well after Luab, if you want to, is our sponsor from Helion? Yes, type in as well. Go ahead, Luab.
Unmute yourself.
I would love to hear
Wrong
from
button. You stopped your video. To the left of that should be your unmute.
I apologize. There's some work being done in our office space, so it's a little noisy, but thanks for your patience.
We can hear you. That's good.
Good, yeah. So I'll just keep my camera off since I'm in transit here, but was honored to be part of the meeting within a meeting to represent Apple Tree's work over the past almost 4 decades now as a nonprofit organization, primarily providing clinical care to older adults and other vulnerable communities. But more importantly, I suppose working in this field to advance policy and incorporate clinical innovations. And the meeting within a meeting setting provided an opportunity to shed light on how provider networks can be part of this important work of learning, generating knowledge from the data we collect day to day providing care. So from the electronic dental records and the clinical experience that our providers can share with scientists and policymakers and the field more generally. So really grateful for that opportunity. And since I'm unmuted here, I also wanted to ask whether the Special Care Dentistry Association, their American Society for Geriatric Dentistry, could be looped into this group's work. I know they're doing some work, and I think Jen Hartshorner current president, is on the call here. They're doing some work around accreditation standards for postgraduate training programs in geriatric dentistry. So some great work to connect with there. Thank you.
Great. Jen, do you want to make a comment about that? Unmute yourself. There you go.
Hello. Thanks everybody for letting me join this call. It's been a wonderful meeting so far. Yes, we are working. We have a group together that is working on advanced education programs. We have a lot of course directors for those advanced education programs in geriatric dentistry who are working together not only to put together a CODA application. We did put a CODA application together. We got some comments and we are revising that right now and we'll eventually resubmit that. But we have been talking about, CODA standards, EPAs, and those things within our organization. So we look forward to that. And also with the previous, Steve Shuman was mentioning the difficulty attracting residents. I agree, we are in the same boat here at Iowa. And it's hard when students come out with so much debt and they're wanting to get to work or they're wanting to get to a specialty and have that kind of certificate when they get out. And so where does geriatrics fall with that? We get a lot of good residents who are, kind of on the public health side of things. They want to help people. They see the need for it or they see the education for it. But it's also hard for some of them to make that commitment, knowing that they're not going to have a specialty at the end or knowing that they're not going to, they're going to struggle financially because we, don't have a stipend or something like that with the program. So we are definitely in the same boat here at Iowa.
I know special care has been very actively involved recently on that whole aspect of making it a specialty. Is there any quick update on where that stands? I've kind of, seen various things over the last few decades, but is there a quick update on what the current push is?
I think that there will always be talk, but in order to get there, certain things have to happen. And I don't know if it's ever going to get there. You know what I mean? I think it's one step at a time and you work on whatever is in front of you right now. And if it happens, it happens. If it doesn't, it doesn't. But right now, the goal is to get students educated. It is to get advanced education programs accredited so we can all be on the same page and train a workforce out there to be able to handle these complex patients.
Thank you.
I know there are a lot of dental hygiene schools actually who have a lot of geriatric dental programs, whether it's volunteer work that they're all required to do or their student associations do at nursing homes, since in so many places they're not rotating through those clinically anymore because of state laws and the school's fears of that being a problem.
Can we
Any other? Go ahead. Repeat.
Sorry, Kim, we wanted to give you a chance if you wanted to say anything on behalf of Helion. Is she gone now? Oh, looks like she might be gone now.
Yeah.
Okay.
Yeah, I thought that Kim mentioned earlier that she may have had to leave the meeting, and I don't know if we have anybody else.
Doesn't look like it. All right.
Okay, any other questions or comments or thoughts from anybody? Just unmute yourself.
Good afternoon. I'm Dr. Stanley. I first met Dr. Ghezzi at a Santa Fe meeting. I'm not even going to say how long ago it is, but I am happy that I finally had time to join a meeting. New Jersey's program is one of the few that has always had a comprehensive dental benefit for adults that also met our income requirements. And it's always been a challenging with workforce and getting providers to understand treatment planning to older populations. And I will say that I like that reframing. And as a baby boomer, I would also like to say that we are the ones that are redefining it. They're just catching up with naming it. But I'm just delighted to be here and to see all the work that you all are doing, and especially because the work is across all disciplines. And that is a challenge I continue to have, you know, meeting with our medical colleagues and their disbelief that no, we really don't have diagnostic codes that we really use so that we can say if a patient has Alzheimer's, if they have rheumatoid arthritis, if they have diabetes, we want to connect a benefit to give them more enhanced periodontal services or preventive services. So I'm just happy to see the work that's being done, and I definitely support you. And I'm going to see about joining the society.
Excellent. We're delighted.
I'm delighted. I'm delighted.
And as the first president who was a dentist of GSA,
okay,
quite a number of years ago, I particularly personally welcome your membership.
Thank you. Thank you.
This is Karen Tracy, and I'm a staff at GSA, and welcome your membership. To illustrate one of our interdisciplinary activities, Steve Shuman mentioned a program that he had worked on related to dementia. That particular program is also highlighted in another one of our programs. We have a program called Care for Brain Health, KAER, Kickstart the Conversation, Assess for Cognitive Impairment, E, Evaluate for Dementia, and R, Refer to Community Resources. And so that particular program that Steve's involved in is referenced in that one. And many of our programs are interrelated. And so we also have a care program on obesity and overweight. And a lot of programs are shared among all these different initiatives. So welcome your membership and everybody's membership here. As Steve mentioned, our meeting is in November. And we do have an oral health interest group meeting, as Steve mentioned. That's our next big meeting.
Yeah, and there is always something special about doing things with GSA because of all of that, the strong interprofessional emphasis. You know, I mean, I think most of us have come to grips with the fact that we're not going to solve the oral health issues of older adults within the dental profession itself. We're going to have to engage all of our other health colleagues, you know, whether it be nursing, social services, pharmacy, medicine, you know, everybody's got a role. And we know a lot about oral health, but we don't necessarily know about all of those other things and needs and the way to connect with people and move the needle on other areas. So having you know, GSA engaged in this is really, to me, the interprofessional part of it is the special part.
Yes, and Karen, I don't know if you can put the link in the chat, or Steve, if you have it, to the white paper that our oral health work group did, and had an entire meeting around it as part of the program, and that was about getting non-dental oral health champions, and GSA is a prime area to do that.
Let's see if I can post it quick here.
Okay.
But we want to respect everybody's time. We appreciate so much you giving us these last 2 hours. Really worked hard to make it valuable for you. And a bunch of nuggets that you've taken with you of resources and links and connections. And again, we encourage each other to connect by email after this, that this, you know, there's a purpose for this to really increase all that collaboration and access to resources. And again, do send us any information that you have that you think you would be important to disseminate, to share with others.
Yes, and Steve just posted the link, so
right,
you know, save your chat.
Yeah, that's the Oral Health Initiative link, and if you go there under GSA resources, you will find our previous publications, including the white paper of Michèle.
Yeah, a lot of great stuff that we've done over the last few years. Thanks to all of our great sponsors and Karen's leadership. So Steve, as chair, do you want to officially close out this meeting?
I just want to thank everybody for taking the time to be here, and of course, thank the work group and our guests like Chris Fox, and again, a tip of our hat to Karen, who keeps us focused and on task. So thank you all, and we hope to continue the conversation and hopefully see you all at the GSA meeting in Tampa.
Excellent.
Sounds good.
Thank
Thanks.
you.
Bye-bye.
Bye-bye.
Bye, everybody.
Bye-bye.